In my Medicare overview video, I discussed how Original Medicare is made up of two parts. Its Part A is for your inpatient hospitalization, and Part B is for your outpatient medical costs. Now, while Original Medicare does cover many of your needs, there are some gaps in that coverage. We try to take care of that with two different types of options, one being a Medicare supplement or Medigap plan, and the other being a Medicare Advantage or Part C plan. I talk more about Medicare supplements or Medigap plans in another video, so now I'm going to go ahead and go over how Medicare Advantage works. And if you haven't yet seen my overview video on Medicare, I do recommend watching that so you have a good idea how Medicare works overall in general. When it comes to Medicare Advantage plans, there are a lot of different options. This is a fairly complicated topic where you have many different private insurance companies that offer a variety of plans. So this is certainly something that you want to take your time and do your research on if you choose to take a Part C plan. With Medicare Advantage plans, there's two broad types of plans. You have either what's known as an MA or Medicare Advantage plan or an MAPD, that's Medicare Advantage with prescription drugs. In the case that you're not able to find an MAPD plan that fits both your doctors and the prescriptions that you need, then you may choose to take just a regular MA or Medicare Advantage plan and add on a Part D or standalone prescription drug plan. Important note with Medicare Advantage plans is that there are networks. Unlike Original Medicare, when you use either the standalone coverage or pairing that with a supplement, you have no networks. So when you take Medicare Advantage, there are networks that you need to be aware of for both your doctors and your medications. Within the general categories of Medicare Advantage plans, we're then going to find four main types of plans. One would be an HMO or a Health Maintenance Organization. Another is a PPO, Preferred Provider Organization, a PFFS, which is a Private Fee-for-Service, and an Dsnp, which is a Special Needs Plan. Of those four plan types, two should be fairly familiar, the HMO and the PPO, as these are very similar to insurance options that you may have got either from an employer in the past or with your own private insurance. So with an HMO, this is going to be a fairly small network. You will be required to pick a primary doctor, and you must see doctors within your network. Also, for the most part, you would have to get a referral to see specialists. So again, the HMO is generally the most restrictive option that you will have amongst these that we discuss. Then you have your PPO, the Preferred Provider Organization. This is a more flexible plan. You're not required to pick a primary doctor. You can see doctors outside of the network, but you may have to pay a higher cost for that service. And you generally do not need to get referrals to see a specialist. So again, this is going to be a much more flexible option to your HMO. Next are private fee-for-service plans. With these plans, you are not required to pick a primary care doctor, and there are no networks. Some plans may have arrangements with certain networks of doctors, but you are able to go to any doctor or any facility that takes Medicare. The only catch is that that doctor or facility must agree to the payment terms of your plan, and they're not required to do so in non-emergency situations. These plans may provide coverage for your medications, but if they do not provide coverage for medications, then you can add on a Part D standalone prescription drug plan. The last type of plan is an Dsnp or a special needs plan. These are restricted to individuals with a specific disease or disability. And there's going to be certain doctors, benefits, and drug formularies that are specially designed to best suit the needs of the group that they're intended to serve. SNPs will have specialists for the diseases and conditions that their members must manage, so all treatment should come from within the network of your SNP. However, in emergency situations, you would be able to go outside of your network. There are a few requirements with SNP plans. They must include Part D. They must also provide yearly mammograms, along with in-network Pap test and pelvic exams at least every other year. The members must have a primary care doctor or a care coordinator to assist with their healthcare needs, and they must get a referral from their primary care doctor to see any specialists. Once you qualify for a special need plan based upon a disability or a disease, then you would have an SEP or a special election period, and this will allow you to enroll in the S&P at any time. Special needs plans also have three of their own variations. One would be an I-SNP, the C-SNP, and the dual eligibility SNP. So the I-SNP is going to be for anyone who is in an institution. It's important to make sure that the providers in your network do service your area. A C-SNP is for anyone suffering from a chronic condition, including things such as diabetes, AIDS or HIV, end-stage renal disease, chronic heart failure, or dementia. The Dsnp or dual SNP is for anyone who is eligible for both Medicare and Medicaid. If you are taking a Dsnp plan, it is important to make sure that your doctors not only accept Medicare, but also accept Medicaid to ensure that you are able to get service with those providers. So now that we've gone over the different types of Medicare Advantage plans, let's take a look at a couple examples of actual plans in a particular area. As you can see on the screen here, I'm using United Healthcare's plan search in Seminole County, Florida. That actually is the county I reside in myself. So you'll see a couple plan options here at first. You're going to see here the Medicare Advantage plans. There's 4 of those in this area. Then you have 10 Medicare supplement plans. Then there are 3 Medicare prescription plans, and then 6 Medicare special needs plans, as we've seen a little bit earlier, those particular special needs plans. So in this zip code, we have these options. And if I change the zip code, I probably see some different offerings, maybe different number of plans for each category, and so on and so forth. We're going to just look into the Medicare Advantage here real quick and go over, again, a few differences. So click on the View Plans, and then we get down here into the Medicare Advantage plans for 2022. And the very first plan here is the AARP Medicare Advantage Hmo-POS. And the POS stands for Point of Service. So this is going to give you access to a local network of doctors. And so the Hmo-POS is kind of in between an HMO and a PPO, a bit more flexible than just a standard HMO, but still a bit more restricted than a PPO. When it comes to HMOs versus PPOs, general rule of thumb is that HMOs will be less expensive but more restricted. PPOs will be more expensive, less restricted. We can see here the premium is $0, so where exactly does it get more expensive is going to be in the coverage that we have provided. The monthly premium is $0, so it's kind of hard to get any cheaper than that, but what is going to be more cost effective is the coverage that's offered in the plan. So we're going to see the monthly premium is at 0. However, primary care provider, you have a $0 copay on that. Specialist has a $20 copay. There are referrals required, so that's where a little bit of the restriction comes in. They do have a national network, but again, this is really designed for the local network. If you were to go outside of that local network into the national network, then you're going to probably have additional costs, higher copays for specialists and primary care. And then the last thing here to kind of point out is this out-of-pocket maximum. That's $3,900. So that's a pretty good rate there to know that you'll have all of your coverage taken care of in the year with a maximum amount of $3,900. Again, you're getting a more restricted network in this plan, but you do have quote-unquote lower costs. Even though your monthly premium is 0 and it's hard to go lower than that, your coverage for services are lower than we'll see in some of the plans we'll look at next, which are PPOs. A couple other things here to point out is some of the coverage that they include. So you have things, again, like comprehensive dental is included, 0 prescription drug deductible. So that's a good feature there, that this does include prescription medication. We'd have to check the formulary to see what exactly is covered and if it meets your particular needs. There is this Medicare National Network, but again, if you access that going outside your local network, you're going to have a higher cost of service there, part of the restrictions. OTC products, routine vision care, and an active fitness program are also all included. So there's your HMO, pretty straightforward. Again, lowest cost plan, but most restricted plan in comparison to what we're going to look at next year. So moving on to the next one, we have the AARP Medicare Advantage Choice PPO. And I'll keep the other plan kind of here in view as well, just so we can do an easy comparison. And so, again, it's a monthly premium of $0. So it's hard to get lower than zero, you would usually see Medicare Advantage plans at zero. So while the PPO is quote unquote more expensive, it's not going to be in the monthly premium necessarily, but in some of the cost of the services. So we can see right away that primary care has gone from zero up to a $5 copay. Not bad. This specialist has gone up to a $35 copay compared to the $20. Still not bad, but again, a little bit more money. Here we have no referrals required, okay? And then we do have the national network. Our out-of-pocket maximum has gone up quite a bit from $3,900 to $5,900. So that's a fair difference. And if we look at this description here, we're going to see that this plan gives you the freedom to see any provider in the nationwide network or any plan provider that's nationwide that accepts Medicare. And you will get additional savings if you stay within the United Healthcare national network, right? So you can go outside of that, but again, you may have higher costs than the ones that are shown here when you go out of network. But getting a little bit more flexible than the HMO plan that we've seen where it's only the local network. So this plan, you have a wider network nationwide, but there is select doctors in that nationwide network that you're going to have the best costs for your services. So we'll move on now to the next plan, which is another PPO, and this is the Choice Plan 2 Regional PPO. So let's see what some of the differences are here. Again, I'll keep the last plan in view just so we can kind of do an easy comparison. So let's start off here. Again, just kind of recap on the description. This is, again, a PPO plan that gives you the freedom to see any provider nationwide that accepts Medicare and also having access to the costs, the reduced costs when you stay in that participating United Healthcare medical network or Medicare national network for the United Healthcare. So again, you have a national network, generally speaking, but you have your best cost inside of the specified United Healthcare Medicare national network. So it is a larger network, but again, some restrictions there, mainly compared to your original Medicare Part A and B that have no network, see anyone, any in the nation. So there is somewhat of a restriction here, even though you still have a national coverage. And then we're going to see here a little bit higher costs, okay? And so this is going to have a $10 copay instead of the $5 in the last plan, a $50 copay instead of $35 for specialists that we had in the last plan. Similar with no referrals required. It is the national network available. And then the out-of-pocket maximum goes from $5,900 up to $6,700. So yet again, another increase. All of these plans so far have had a $3 copay for their prescription drug on the Tier 1. And if we look over here in the items that are kind of listed in the plan here, some of the highlights, we have that United Medicare National Network. We have routine eye exams, as were in both those plans, routine vision care, routine eye exam, a little bit different there. We have that fitness program in all the plans, routine hearing coverage. Both PPOs were providing that. But here we have a difference, this low insulin copays. And then we have the reward for staying active. So this plan here, just from reading that or seeing that, suggests that it has some favorable coverage for insulin or prescriptions. So this plan here, with its higher costs and more flexible network, also is providing you those prescriptions. So there's probably something taken back in this plan. And that's going to be the higher cost of services, right? So you're going to have better coverage for some medications, but you're going to be paying more for it. Just kind of logical in that sense. Now, the last plan we're going to look at here, moving down this 4-plan selection, is the Advantage Patriot Regional PPO. So let's read the description here on that. Again, keeping the last plan kind of in view. So this is a PPO plan that gives you the freedom to see any doctor nationwide that accepts Medicare without referrals, for specialists, or hospital visits. Prescription drug coverage is not included. These two plans here are a good example of an MAPD, which is this plan up here. Here's your MAPD with that prescription drug, very favorable prescription drug coverage in it, in fact. And this here is an MA plan that has no prescription drugs. So MAPD and MA plan. We would have to add a prescription drug plan onto this plan. So while it is a $0 monthly premium, it's actually going to cost us roughly about $30 more than any of the other plans we looked at, because we have to add on that prescription medication plan. What we're getting in return for adding that cost is that wider network. So if you notice in this here, there's no talk of the United Healthcare or the United Healthcare Medicare National Network. They list it here, but you're not going to get any better rates in that network than you would from just any doctor that takes Medicare. So this plan is now approaching and very similar to what you're going to get with an original Medicare Part A and B national no network plan. So you have that. The only thing you don't have is prescription drugs really in this plan. And so not a bad offer. Again, it's $0, not adding any costs. We do have some, co-pays here. It's not really any different than the last plan that we were looking at. If we do the comparison, we have a $10 copay for our primary care. We have a $50 copay for specialists. No referrals required. National network, out-of-pocket maximums at $6,700, same as the other plan. A difference here is that there is a Part B premium reduction up to $50, and that's not in any of the other plans. And so it kind of washes out that cost for the prescription medication plan. So it's really not that bad. I would pick this plan if I don't have any, specific medications that are, very expensive, maybe just a few generics. This is a great plan because not only am I going to have that national unrestricted network, but I will have good coverage for my medications as well, and the cost, could be still down at $0 if I get a medication plan that costs $30 and I get that Part B premium reduction up to $30. So it could be, a pretty fair comparison there. Now I'll go ahead and quickly drop these two plans just in a side-by-side and run through them real quick, just so you can see a little bit clear how these two plans really compare. Again, we're looking at the one on the left is the regional PPO with that special prescription coverage for insulin. So this is an MAPD plan versus the one on the right, which is just an MA plan with no prescription coverage. But we can see pretty much same coverage overall here. Monthly premiums, primary care, specialists, all that is the same. Here we have same coverage, monthly premium, $0, deductible $0. The Part B premium reduction, that was something that was, again, specific to the Patriot plan that doesn't have prescription medication, so it's kind of their way of compensating for that, which is pretty nice. Specialists, pretty much identical. Inpatient hospital care. Now this is a really interesting section here. If you recall from watching in my original Medicare Part A and Part B videos, or some of my other videos that goes into the specifics on Part A coverage, there is a huge gap there when you are to be hospitalized beyond 60 days, where you have to start paying a daily copay, and you run the risk of running out of reserve days, which go beyond 90 days of hospitalization. And once you run out of those lifetime reserve days, you no longer have those. So you could get into a situation where you get hospitalized a few times and then you start paying the full cost of that stay, which is several $100s per day. With this plan, you have to pay your copay of $400 roughly for the first 4 days, and after that it's covered in full. So that's a pretty good offering with a Medicare Advantage plan here. And while the supplements generally are a superior product, if you're on a budget and you're fairly healthy, this is a pretty good offer here. I mean, the cost proposition on this is, I don't think it's terrible. A lot of people maybe kind of look at Advantage plans in a bad way, but for some, I think it can make great sense, filling in those gaps very, very well. Kind of moving on down here, ambulatory surgical services, same coverage on both plans. The outpatient, same. Mental health, it's pretty much the same, dead on exact actually. Lab services, same coverage. So these plans are, as you can see, are fairly identical. There is a slight difference here on the diagnostic radiology services, where you could have a $0 to $100 copay versus the $0 to $90. Small difference, but overall the plans are pretty much the same. Here in some of the additional coverage, we see some differences. So that coverage, or the plan with the insulin coverage, they don't have any dental or any eyewear coverage, so that would, maybe an additional cost in that plan. to get those services if you need them, but you're going to probably be doing yourself a favor by getting that plan if you are diabetic and saving on the medications. Then we kind of move on to, we do have that in the Patriot plan. We do have some of those, the eyewear and the routine dental is covered, so that's a nice feature in that. Moving on down here, again, pretty much all the same. Fitness is included. Hearing aids is included in both plans. Transportation is not included in either plan. We have some particular coverage here on the over-counter for the Patriot plan, so you get a $4 credit per quarter. It's a nice feature you don't have in the other plan. Other than that, things are fairly similar. Chiropractic care or acupuncture not offered in either plan, nor is naturopathy services. So moving down here, now we see a big difference, prescription drug benefits. And as you'd expect with the MA plan on the right, that's just Medicare Advantage, there is no prescription drug coverage listed, as you can see. And then on the plan on the left there that is favorable to insulin, we can see some really good copays, starting with the Tier 1 drugs at $3. Your generic medications would be, the first Tier 1, there's your preferred generic. Then the next Tier 2 is your regular generic. That's $14 copay. Preferred brands are at a $47 copay. Select insulin drugs, this is really where this plan's strength is. You have a $35 copay on those. Again, making sure that your insulin or your medications fit within that formulary is very important. And then we have non-preferred drugs, $100 copay, and then specialty tier drugs here. It's going to be 26% of that cost. So again, this MAPD plan may really solve a lot of needs for people, particularly with diabetes, whereas the plan on the right here that has the Part B give back may not be such an ideal choice if you do have some specific medications or some insulin or diabetic medications that you need. So this is just a pretty clear example of how the plans really differ and what they're able to accomplish, making sure that you're picking the right Medicare Advantage plan for your particular needs. If you take the time to do that, there's a good chance you can find a plan that does service your needs. If you're willing to deal with some of the restrictions that you get as far as the networks being a little bit limited compared to your original Medicare Part A and Part B, in exchange for having these huge gaps filled, right? So I mean, the other side of the coin, if I were to stick with the Medicare original Part A and B and run with a supplement, my costs are going to be much higher than either of these Advantage plans just for the basic coverage, not even including prescription drugs. I'm going to have to add a supplement on for usually around $100 extra per month. Now, those plans do have great coverage at the end of the day, but not everybody has the budget to pay a Part B premium of $170 plus an additional premium for your supplement of $100, then a prescription drug plan on top of that for average about $30. So you're all in there. A rough estimate on a supplement plan is $300 per month versus this Medicare Advantage plan here, $170 a month. And, depending on my case, I can find good coverage for two really extreme cases here, as we've shown. This is just 4 plans. This is just United Healthcare. I'm sure there's several different providers like Aetna, WellCare, Humana are in this area as well. You will have more difficulty finding plan options with different varieties and more smaller markets, but in large markets, these Medicare Advantage plans may be a very good cost proposition for your particular needs compared to a supplement, certainly compared to just sticking with original Medicare Part A and B, where you have some major gaps that could really be a financial burden if you're to fall into them. You should now have a good understanding of the different types of Medicare Advantage plans that are available, as well as which one may be best for your particular needs. However, keep in mind that there are so many different options when it comes to Medicare Advantage that you definitely want to take some time and do some research. Shop your plans amongst the different providers in your area to make sure that you are really getting the best coverage for the cost. And this is where working with a broker can really be a great benefit, as they will often know the plans very well in your area and they can make some great recommendations. So if you still have any questions or anything's just not very clear about Medicare Advantage plans, add a comment below or email me directly. My email is in the description along with a link to my calendar. There you can set up a free 30-minute consultation to speak with me one-on-one. And if there's anything that you'd like to see me cover in future videos, just let me know. I'm glad to do that. I appreciate you viewing. Thanks for watching. If you found the information in this video helpful, you know what to do.